Hi everyone, my name is Emma Bergman and today I'm going to be presenting on Lyme disease. So, Lyme disease is actually a fairly recently discovered disease, but it has been on the rise recently, and a lot of celebrities have actually come out and shared their struggles with this disease, including Avril Lavigne, Bella Hadid, Shania Twain, Justin Bieber, Amy Schumer, and Alec Baldwin. The causative agent of Lyme disease is Borrelia burgdorferi, and this is a pathogenic spirochete, so it is helical, and its dimensions are about 0.2 to 0.5 micrometers by 10 to 30 micrometers. Its genome is about 910 kilobase linear chromosome, but depending on the bacterium, it may also have circular and linear plasmids. And it is a tick-borne obligate parasite, which means it cannot exist on its own, but has to be hosted by either a tick or a vertebrate host. Its taxonomy is within the kingdom Bacteria, the phylum Spirochaetae, and the genus Borrelia. And in the US, we only see Borrelia burgdorferi causing Lyme disease, but in Europe, 4 other species of Borrelia can also cause Lyme disease. And here we see an image of that typical spirochete shape of Borrelia, and this is an image obtained through dark field microscopy. So, as I mentioned, Lyme disease was discovered fairly recently. It was first identified in 1977 in Lyme, Connecticut, because a group of children were exhibiting signs that they thought were perhaps juvenile arthritis, but in 1982, Dr. Willy Burgdorfer discovered the causative agent, Borrelia burgdorferi, in the midgut of ticks that had bitten these children, and he realized that that was what was causing Lyme disease. So in terms of incidence, you can see here a map from 2019 that the CDC had posted on their website of the cases in the US, so that was the most recent one that I could obtain. But you can see that the cases are most heavily found along the East Coast and in the northern Midwest region of the United States. We have about 300,000 reported annual cases, with a rise recently from 25,000 new cases per year to 30,000 new cases per year. And this may in part be due to increased awareness of the disease, but also could just be an increase in those infections, so it's hard to say. But the groups of the 2 age groups that are seen to be most likely to have Lyme disease are children 5 to 9 years old and adults 45 to 59 years old. And as I mentioned, it's really common in the eastern United States. It is considered endemic to Connecticut and southern New York. So in terms of transmission, the vector, which is the black-legged tick, or also known as the deer tick, is most likely to transmit this infection to humans when it is in the nymph stage, as you can see in this image. So the nymph stage of the tick is most likely to be out and about in late spring and summer. So that is when we see people becoming infected with Lyme disease most often. However, its natural reservoir is usually small mammals or birds, and it doesn't usually cause symptoms or disease in these natural reservoirs. In terms of research efforts, a lot of the more chronic manifestations of Lyme disease are not very well understood, especially because they can have such different manifestations in different people and according to the infection. However, a lot of research focus has been placed on this due to that recent increase in infections. And they've been doing different genome analyses, including in vivo expression technology, signature tagged mutagenics, and transposon sequencing to kind of figure out what's going on with that genome and why it causes different symptoms in different people. And actually, one of the recent studies that I read about was one that was conducted in 2020 at Johns Hopkins University. And they found that when they isolated healthy dendritic cells from patients and then exposed those dendritic cells to Borrelia burgdorferi, it caused a structural change in the MHC class II cell surface receptors of those dendritic cells. And recall that usually those cell surface receptors are going to present the invader to T cells for destruction. But instead, Borrelia burgdorferi caused a structural change in those receptors, which caused T cells to then respond and attack healthy cells in the body rather than attacking the cells infected with Borrelia burgdorferi. And so the research concluded that this may be why a lot of times people who have genetic predisposition to autoimmune disorders may develop those disorders due to an infection with Borrelia burgdorferi or Lyme disease, because it causes your body to start attacking itself. And in terms of pathogenesis, the Borrelia burgdorferi bacteria lives in the midgut region of the black-legged tick. So when the tick bites a host, a vertebrate host that has blood, that blood flows into the tick's midgut and starts feeding the Borrelia burgdorferi bacteria. And that bacteria does not have certain nutrients it needs, and it receives those nutrients from vertebrate blood, and that allows it to start replicating very rapidly. And the bacteria then flow out of the tick and into the skin, where it starts to continue replicating and spreading in the skin, which leads to a pretty typical manifestation of early Lyme disease, which is a bullseye rash called erythema migrans. And it looks like a bullseye because you can see that the bacteria is kind of spreading outwards from the bite through the skin. And it's not clear exactly whether the infection spreads through the blood or the lymphatic system, but it moves throughout the tissues and starts to cause a lot of different symptoms. So this image is pretty complicated, but I included it to highlight the fact that one of the really characteristic aspects of Borrelia burgdorferi is that it's really good at evading the different immune responses of the body, including complement activation, the lectin pathway, classical pathway, and alternative pathway that we touched on in class. And it has a lot of different ways of evading that, including the way that I talked about in that previous research. So it's really good at evading your immune system, and that's why we see it really setting in for those persistent, lingering infections. So in terms of symptoms, Lyme has 3 different stages. So early localized Lyme disease is usually characterized by that bullseye rash that I discussed, in which the infection starts to spread through your tissues. And you can see an image of it here on someone's ankle. And if it is not stopped at this point, it can start to become early disseminated Lyme disease, in which you may see a variety of different symptoms, including annular lesions, which are circular raised lesions. You can also see headaches, fever, chills, profound malaise, muscle aches, and neck stiffness. And you can also see some extra complications, including cardiac or neurologic complications. And the late disseminated stage of Lyme disease can include symptoms such as chronic arthritis, especially of large joints like the knees, neurologic sequelae, which may include issues with sleeping, memory issues, and impairment, and depression, just severe and chronic fatigue, etc. And also you can start to see some encephalopathy issues. So in terms of diagnosis, Lyme disease can be kind of hard to catch in that early localized phase because of the delay in immune response that we see due to Borrelia burgdorferi being so good at evading the immune system. But once you get into those early disseminated and late disseminated stages of the disease, serologic testing can usually be pretty reliable, and this is accomplished through ELISA, or enzyme-linked immunoabsorbent assays, and Western blot testing. And in terms of treating this disease, Borrelia burgdorferi, as I mentioned, is a bacteria, so treatment is usually prescribed as a round of antibiotics over the course of 2 weeks. And this can kind of vary, especially if you have those neurologic or cardiac complications. But it's usually pretty effective if you catch it in those 2 earlier stages. But once you get into the late Lyme disease with those chronic infections of the joints and sometimes of the nervous system, you could take about a month of antibiotics, but it hasn't been shown to be as effective because that infection really just sets in. And in terms of prevention, there is no vaccine currently available for Lyme disease. But if you do live in an endemic area for Borrelia burgdorferi, a lot of times just taking care to clear brush and trees, remove leaf litter, mow the grass, and apply pesticides as necessary, those steps can all reduce the likelihood that you will be bitten by a tick and may get Lyme disease. Another thing that I was reading about a lot when I was researching this topic was there's a lot of argument about the best way to remove a tick. So I just want to go over those really quick in case you ever get bitten by a tick and you need to know how to remove it. So some people say that the best way to remove a tick is just to grip the tick by its head really carefully with a fine-nosed tweezers and just pull it straight off. But apparently people get bit by ticks a lot in Australia, and they swear by just taking a thread, looping it around the tick, and pulling it tight slowly to really wedge that tick out of your skin. So now you know how to get rid of those ticks if you ever see them biting you. And yeah. So that concludes my presentation. Thank you so much for watching.